So I'm back today to do a little tutorial about kind of my experience, what I've learned about the handoff process from doctor to doctor, procedure to procedure when you're dealing with cancer diagnosis. I'm a nutritionist, I'm not an oncologist, so I'm definitely not speaking as an expert. I'm speaking as a frustrated user who has been very poorly oriented to this process myself, and so I'm guessing that other people may be struggling as well. And since I've kind of learned how it works, I'm just wanting to show others how it works, at least here where I live in the US. Probably doesn't work this way in other countries. So if you're living in another country and dealing with this challenge in another country, my tutorial today won't be as useful to you. So just starting at the beginning, I've kind of charted out what the biopsy and diagnosis process looks like. So it starts out with your PCP referring you for a mammogram or an ultrasound in my case, which leads then to an MRI in most cases, which may point back to a diagnostic mammogram or a diagnostic ultrasound, and back and forth up here for a little while maybe. And finally ending in a biopsy, which ends you up in the radiologist's office. The radiologist is a pretty temporary relationship. You're not going to form a bond with them long term unless you go back for multiple biopsies. But even so, it will be pretty temporary and limited. What I learned that is a little bit difficult for me, that I'm getting used to and struggling with a little bit still, is that there's kind of a jagged line right in here that separates all the people you're working with prior to the oncologist from the oncologists. So your PCP is a central part of this process up here, or maybe your GYN. They kind of go quiet after that, and unless you get a virus or your sciatic nerve starts acting up, they're not going to really be interacting with you much about your body. They're going to point you to the oncologists, which to me feels pretty traumatic in some ways, because there's a lot of emotional bonding and reliance at this point going through this stuff up here with your PCP, and to have them kind of say, okay, now don't call me unless you have something unrelated to cancer, feels a little bit, to me, with my background in attachment disorders, feels a little bit like abandonment. So it's a little hard for me to handle that news, and probably for you too if you're going through that. So I just want to name that and express that it's frustrating, let you know you're not alone if that's an aspect of this journey that you're frustrated with. Hopefully in the future there will be a bridge, but there's a good reason for the separation. The oncologist really needs to be the authority. They need to not be contradicted by any other doctors. Otherwise they feel as though their recommendations are just not taken as seriously, I guess. I personally feel like that's not as important. So I don't know. I feel like in some ways there's a bit of a conflict of interest with an oncologist, especially a surgical oncologist, because they stand to benefit from your deciding to take their advice. They make a lot of money when you get surgery. So I feel like there's a bit of a conflict of interest, and I feel like it will be identified and addressed eventually, and history will play out, and we will have a better system in the future. But for now, you don't really have an advocate to go in with you that's not biased. You're dealing with this oncologist, surgical oncologist at first, who does have a bias and who does have a conflict of interest of sorts. So just to know that, that's why I feel that I'm putting the stress on the integrative oncologist, this person over here who is, in my state, not a medical doctor. So this is an MD over here, or a surgeon. And over here in my state, the person I found to represent my alternative health approach to cancer is a naturopathic doctor. Now in other states you can find medical doctors who are integrative oncologists, and they will have a little bit of a louder voice in the room. They will even maybe be invited in the room where a naturopath won't be invited in the room with the surgical oncologist. I personally invited mine, even though he's a naturopath, because I really want him in the room, and I'm being very assertive about that. So let's go into what their roles are before we talk any more about the process. So the surgical oncologist would be the first oncologist that you meet with. They're the main oncologist, and they would be also your surgeon if you should have surgery. But the first thing they're going to do is more testing on your biopsy results. For whatever reason, the radiologist only does one set of tests, and there's another set of tests that can be done optionally by the oncologist, especially if you choose a more progressive oncologist. So in my case, I am going to be asking for those tests. There's a couple of different names for them, but basically it's a genetic test. It's an oncotyping of your cancer cells. And after that, they will recommend either more biopsies or potentially surgery to remove whatever you have going on in there. And then they might send you to another oncologist that will represent the meds and the radiation. So chemotherapy meds, anti-estrogen meds, and then eventually the radiation therapy if you get that. The integrative oncologist over here will be doing more conservative approaches to cancer. So things that also enhance these things over here. So they're not working against each other at all. They're always going to be enhancing these things. So they'll work on a nutrition and exercise plan. They'll work on supplementation, so getting extra antioxidant supplements in. They'll work on alternative therapies such as hyperbaric oxygen perhaps, and then they'll do some ongoing education to help you really get firm in your lifestyle practices long term. So again, these work really hand in hand. They are traditionally kind of opposing schools of thought, but they're being married very nicely in our hospital systems right now. So they're working together for the first time, which is really wonderful. So at least we've got that going for us. But I'm really sad personally that in Oregon, at least, we don't have very many or any that I could find medical doctors, so MDs, that are playing this role. I feel like we need more of that in the world today, and the reason for that is the MDs are taken a lot more seriously by other MDs in the medical world, and they could, in my case, for someone that's very staunchly conservative in terms of wanting to resist invasive therapies, or therapies that are not very well proven to work terribly well, they can really advocate for us when we want that. So that is something that I'm really kind of grieving the loss of, that I don't have anyone locally here who can do that for me. I have a naturopath, so that's good, that's something, but I don't have an MD locally who can really kind of go to bat for me in that way. And maybe I won't need that, we'll see. I'm still very early in my journey. But eventually then you will be able to go back to your PCP after all of this cancer stuff kind of gets resolved, and that will be the main person you'll work with again, once again. Maybe all of your cancer stuff won't ever get resolved, and you know, that's a really hard struggle, especially if you really like your PCP and you really want to talk to them about what's going on with this cancer stuff. So that's kind of my overview. It's a little bit tricky and messy, and it doesn't always follow this this flow chart that I've demonstrated for you quite as neatly as what I've demonstrated, especially when you have to go back and get more biopsies and different kinds of biopsies. For some people, you will just fly through this list and go boom, 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 because you've got an aggressive cancer. For those of us like me who don't have, at this point, it hasn't been identified that I have an aggressive cancer. It could possibly still be identified, but for me, I can go a little bit slower and do some of this stuff before I do some of this stuff, which I just want to make that really clear that when I talk about how I'm going slowly and doing this stuff, it's because I don't have a metastatic cancer. I don't have a fast-growing aggressive cancer that's multiplying cells and flowing through my bloodstream and going to other organs, for example. So that's a very, very different situation from all of the processes that I'll be describing with my scenario. So I just wanted to kind of lay that out and acknowledge that it's a hard process. I am actually really upset that I had to say goodbye to my PCP and my GYN, who I love, and they've become friends and I've known them for years. I'd really like to get their input on what's going on. I'd love for them to be sitting there when I meet with the surgical oncologist and for them to explain for me that I might not be that type of patient. Maybe they already have. I'm sure that they will a little bit, just because they do know my oncologist. They're the ones that referred me to her. So maybe they'll give her a little heads up that I am going to be more conservative and that I am going to resist the pharmaceuticals and start with the natural approach. So I know that they will be talking to my integrative oncologist. They both also know him and will be checking in with him just as kind of a handoff. And the other thing that's important to note is that when you do have things that are discovered in your cancer journey with your medical or surgical oncologist, or even your integrative oncologist, when those things get discovered and documented, those documents will be sent to your PCP and your GYN if you ask for them to at the offset. So they will be aware of what's going on with you. So it's not like they're just going to be completely off the map and ignoring everything. They'll be silent, but they'll be silently informed. So that's a little reassuring. But yeah, it can be emotional. I had a telehealth appointment with my GYN yesterday, and I realized it was kind of like a goodbye. I didn't know when I would be speaking to her again because she only deals with hormone replacement therapy for me. Like, that's her main area. She tests my hormones every 6 months, and she prescribes natural bioidentical hormones for me to take. And because the oncologist now has reign over that territory in my life, my GYN she's a naturopath, so she's not an MD or an OB-GYN technically, but I call her my GYN because that's kind of her specialty. She's going to be silent. She's not going to be prescribing anything for me. If I want bioidentical hormones, I'm going to have to talk my oncologist or perhaps my integrative oncologist into prescribing them for me, which will be a hard sell because hormones right now at this point in history are considered the enemy of cancer in many cases. Not in every case, but they're highly suspect. And I think, again, I'm predicting from all that I've done and read and researched and doctors that I've talked to and heard from, that probably won't always be the case because it's a very simplistic approach and reaction to a very complex system. So hopefully bioidentical hormones won't be seen as the enemy of cancer for too much longer, but for now I'm going to get a lot of flack if I want to keep taking them. So I won't be able to go to that person who has been my assistant in that area and my support in that area, and I won't probably even be able to get her to do any more hormone testing to see where my hormone levels are in the future. I'll probably have to do that through the oncologists as well. And that's something that is grieving me. It's not something I'm happy about. It's not natural. I keep saying that. But I just think it's important to say that. There will be parts of your cancer journey they will not feel natural. They will not feel good. And it's just the best that we can do right now in the system. It's not because anyone wants to do the wrong thing. It's because they can't have 4 different opinions about what's best for me flying around and confusing me in this already really overwhelming and confusing process. So it's for good reason that my lovely, trusted, wonderful doctors are being kind of shut out of my cancer planning process. So I just want to put that out there so that people aren't shocked by it. If you're looking ahead and you have kind of a slow uptake and you're waiting maybe for your biopsy results and you wanted to get some information from someone like me in the meantime, that's why I'm putting out this video. And that's all I have to say about that for today. I think my next video I will talk about my struggle to determine if I'm going to be changing my nutrition plan and that will determine a lot. It will have a lot to do with what I learned from my integrative oncologist. So it will be an ongoing struggle, but I'll check in with you about that really soon, and probably I'll have a number of videos about that because that's the area that I'm most experienced in and I have the most to say about. So probably be a few videos about that. So look for my next video. Again, my cancer videos are on the cool side, so blues and grays on the thumbnail photo that you click into to get into the video. And my normal, old, everyday nutrition, lifestyle, spirituality videos are on the warmer side, so more reds and purples and browns and warmer yellow tones in the photos of those videos. So hopefully that's not too confusing, and I'll catch you on the next video. Take care.